Stress fractures is an orthopedic disease condition. Look at this picture shows that stress fracture in metatarsal bone. Look at this. Then X-ray findings, fracture in radius. Then bone scan findings, stress fracture in tibia. Look at this. Then CT scan findings and MRI, magnetic resonance imaging, most effective in detecting early stage stress fractures. Look at this picture. A detail going on. Introduction. Stress fracture are commonly cracks in a bone that results from repetitive force or overuse. They are common in athletes, military personnel, and individuals who engage in high impact activities. Unlike acute fracture, stress fracture develops gradually over time due to continuous strain on the bone. A definition: a stress fracture is a thin crack in a bone caused by repetitive mechanical stress rather than a sudden impact. It typically occurs in weight bearing bones such as the tibia, metatarsals, and femur. Etymology: the term stress fracture combines stress from the Latin structures, meaning drawn tight or compressed, and fracture from the Latin fractura, meaning breaking. It was first used in medical context to describe small hairline bone fractures caused by repetitive mechanical strain rather than acute trauma. Types: 1. Fatigue fractures occur due to excessive stress on a normal bone, commonly seen in runners and military recruits. 2. Insufficiency fractures occur in bones that are weakened due to osteoporosis or other conditions often seen in elderly individuals. 3. Complete stress fractures when the crack extends throughout the entire bone. 4. Incomplete stress fractures when the cracks does not completely break the bone apart. Causes: 1. Overuse or repetitive impact, example running, jumping. 2. Sudden increase in activity level. 3. Poor biomechanics or improper footwear. 4. Muscle fatigue, reducing shock absorption capacity. 5. Nutritional deficiencies, example calcium, vitamin D. 6. Osteoporosis or weakened bones. Risk factors: 1. High impact sports, example basketball, gymnastic, long distance running. 2. Sudden changes in exercise intensity or duration. 3. Poor nutrition. 4. Inadequate rest between workouts. 5. Weak bones due to medical conditions. 6. Improper footwear or training surfaces. Complications: 1. Delayed healing or non-union. 2. Complete bone fracture. 3. Chronic pain. 4. Decreased mobility or permanent disability. Pathophysiology: repetitive mechanical stress lead to micro damage in the bone. When the damage accumulates faster than the bone can repair itself, a stress fracture forms over time without adequate rest. This micro damage extends, resulting in a complete fracture. Pathophysiology of stress fracture step by step process. First step: repetitive mechanical loading. Bones experience repeated micro trauma from activities like running, jumping, prolonged standing. This mechanical stress exceeds the bone's natural ability to repair itself. To bone remodeling activation in response to stress, osteocytes, bone cells, signal osteoclasts to remove old or damaged bone. This resorption process creates temporary weakness in the bone structure. 3. Imbalance between resorption and formation. Normally, osteoclasts, bone forming cells, replace resorbed bone with new, stronger bone. However, excessive repetitive stress leads to more resorption than formation, creating weak spots. 4. Accumulation of micro damage. Small cracks form in the bone due to repetitive strain without adequate recovery time. These microfractures coalesce and propagate if stress continues. 5. Development of stress fracture. When micro damage exceeds the bone's repair capacity, a complete stress fracture occurs. This leads to localized pain, inflammation, and potential structural failure of the bone. 6. Delayed healing or progression to full fracture. If activity persists, the stress fractures may worsen, increasing the risk of a complete bone break. Proper rest and interventions are necessary for healing and preventing complications. Signs and symptoms. 1. Localized pain that worsens with activity and improves with rest. 2. Tenderness at the fracture site. 3. Swelling and bruising. 4. Reduced range of motion. 5. Pain that persists even addressed in severe cases. A diagnosis. 1. Clinical examinations, evaluation of pain patterns and activity history. 2. X-ray, often ineffective in early detection. 3. MRI, magnetic resonance imaging, most effective in detecting early stage stress fractures. 4. Bone scan, used if MRI is unavailable. 5. CT scan provides a detailed view of the fracture site. Nursing diagnosis. 1. Acute pain related to bone micro damage. 2. Impaired physical mobility related to pain and bone injury. 3. Risk for impaired bone healing related to inadequate nutrition or excessive physical activity. 4. Risk for complications such as non-union or complete fracture. 5. Deficient knowledge regarding prevention and management of stress fractures. Medical management. 1. Pain management. NSAID is acetaminophen. 2. Immobilization, bracing, splints. 3. Activity modification, avoiding high impact activities. 4. Physical therapy, muscle strengthening, gait training. 5. Surgery in severe cases, internal fixation with screws or plates. Nursing management. 1. Assess pain and mobility limitations. 2. Educate on activity modification and weight bearing restrictions. 3. Encourage proper nutrition, calcium, vitamin D intake. 4. Monitor for signs of complications, example persistent pain, swelling. 5. Provide emotional support and coping strategies. Treatment options. 1. Rest, essential for bone healing. 2. Ice therapy, reduces pain and swelling. 3. Compression and elevation, helps manage inflammation. 4. Physical therapy, strengthening exercises once healing begins. 4. Medications, pain relief with NSAIDs or acetaminophen. 5. Surgical intervention for non-union or severe fractures. Psychosocial medicine. 1. Patient education, informing about causes, treatment and prevention. 2. Counseling and support groups, emotional support to prevent frustration. 3. Cognitive behavioral therapy, CBT, helps manage pain perception. 4. Encouragement of alternative activities, low impact activities, example swimming, yoga. 5. Family involvement, ensuring support at home for adherence to treatment. Prevention. 1. Gradual increase in exercise intensity. 2. Use of proper footwear. 3. Balanced diet rich in calcium and vitamin D. 4. Strength training to improve muscle support. 5. Adequate rest between workouts. In conclusion, stress fractures are common injuries that results from a repetitive strain on bones. Early recognition and management are essential to prevent complications. With proper rest, treatment, and preventive measures, individuals can recover fully and reduce the risk of future fractures. Thank you. Have a nice day.